about endocarditis. Now, in peds, endocarditis is the same like rheumatic fever, but in adult, it is called endocarditis. Endocarditis is because the lining of the heart, there's a bacterial infection that takes the lining of the heart, affects the lining of the heart, which causes the heart to fail. Now, endocarditis, right? Normally, who gets that? Patient who does not go to the dentist. You know they say if you don't go to the dentist, you'll get heart disease. That is what they're talking about. People who do drugs, IV drug users. You find a lot of endocarditis in white male, right? So, endocarditis, if we don't fix it, the patient go into heart failure. Remember, MI if we don't fix heart failure. Angina if we don't fix heart failure. CAD if we don't fix heart failure. Heart failure, yesterday I told you it is a pumping problem. MI, I told you it is a clot, right? That sits on the artery that prevent blood to flowing. Angina, I told you it can be bulges or bulsan. English, it can be a clot or it can be some type of lipid, right? And CAD, everybody know that is atherosclerosis, which is lipid. Now, endocarditis is not a clot of any form, so I do not need to do cardiac enzyme because there's no tissue that is dead. There's a bacteria infection, so we need to give you IV antibiotics. Now, how do you know this patient have endocarditis? When this patient come to the ER, you're going to look at their finger. In their finger, there's going to be a long red line, and that is called splinter hemorrhage. That tells you that patient have endocarditis. The patient will have a fever. The patient will be anorexia. The patient will be weight loss. The patient will have fatigue, and the patient will always have a murmur. Anytime you have endocarditis, you also have a murmur. Now, you got to be careful. So I'm going to ask you what drug to give. Don't say the Joxin. Why the Joxin? Hey, but he can't get the Joxin. But when? Not now. He will get the Joxin, but not now. When will he get the Joxin? When it goes to heart failure. Now, stay with me. You remember yesterday I did the blood test. The crime has to meet the punishment. With what blood test? Be careful. What blood test will the doctor do here? Why would you say BNP? Wait a minute. Hold on. Why would you say BNP? Who said BNP? You got to own it. Okay. Why would you say BNP? You're not wrong, you're not right, but I want to see if you understand. Talk to me. Pour qui ça docteur a fait BNP pour lui? Why would think? I taught it to you yesterday. Why would the doctor do BNP right now? To rule out heart failure. Docteur a besoin connaît if his situation went into heart failure. See, you was right. But I needed you to explain to me. Right? So the doctor will do a BNP not because the disease caused BNP out. The disease don't ask for BNP. The doctor want to know s'il est arrivé, if it reached to heart failure. Any question? Now, what test will the doctor order? Somebody said WBC, right, Susan? Okay. We agree with Susan. WBC. Is Susan right with WBC? Yes and no. The doctor will do a WBC to check what type of infection. But the blood test the doctor will order will be ESR and C, reactive protein. CSR. DCSR, excuse me, ESR. Because, listen, Susan, the bacteria, the doctor the reason he's doing the WBC, guys, so he can see what type of infection. That's one. Now, because of the bacteria causes some kind of inflammation, he wants the test for rheumatic fever, the test for endocarditis is ESR and C reactive protein. So, blood test, he will do WBC to check for what? What type of infection. He's going to do ESR, C reactive protein, right? He's going to do a BNP to do what? To rule out. Okay, why is he not going to do cardiac enzyme? Because there's no tissue damage. Look how beautiful and you understand. Because there's no tissue damage. We only do cardiac enzyme, let on boule graisse ou boule sang, chita sous tissue that causes tissue damage. English. We only do cardiac enzyme when there's some kind of occlusion that causing blood to not flow. That's why we don't do CEs in heart failure, and we don't do CEs in what? Endocarditis, because there's no tissue what? Any question? We cool? You see, when you understand, it looks good. Now, without looking in your book, without looking in the book, what's the nursing intervention for this patient? What's the main problem with this patient? Infection that causes the what? Fever. Right? So what's priority? Antibiotic, fluid, rest, right? Now, if the patient starts saying, I have shortness of breath, what happened to this patient? The endocarditis went into what? All right. So you see, you're going to answer the question by what the question asks you. Now, are you going to give the Johnson and Lasix? You may, but you ain't going to give the Johnson and Lasix for what? For the disease. Now, what teaching you going to teach this patient? Keep it simple. Stop staying away from crowd. No. Stick with endocarditis. Get your dental cleaned up, right? Wash your hand, right? When you have a cold, be careful, okay? Report any frequent ear infection, right? When you are sick, stay away from other people because your immune is low. But you don't tell them stay away from crowds like this. You got to explain to them why. Because if you tell me stay away from crowds, I'm never going to go outside. But if you tell me when my fever is high, my immune is low, now you stay away from crowd. Yes?
If you're going to get any procedure done, you have to inform that
for the rest, yes. You got to be careful for the rest of their life. So I'm trying not to say that. So to make it better, anytime they're going to go get like deep cleaning, antibiotic. Okay? Any question? Yes. Okay. The ESR, C-reactive protein is always elevated when the patient have what we call connective tissue disease. Connective tissue disease are lupus, arthritis, right? A disease that causes fever, but the fever has nothing to do with infection. It's inflammation. That's when we do ESR. Ou fever, but nous checker soon, it has nothing to do with infection. And the reason this disease fall under connective tissue is because when you have the bacterial infection, it causes the lining of the heart to inflame. Any question? You see, when you comprend, now you go to NCLEX, and they ask you any question on endocarditis, and they give you a finger, and they put a long red line. Right away, you know what disease associated with this. Now, endocarditis, will you isolate this patient? No. No. Any question? We cool? Wash hand? Yes. Okay? So check endocarditis. Right? Okay. Now, and a lot of time, NCLEX may ask you, when you have endocarditis, what part of the heart is affected? Valve. That's why the patient has murmurs. Yes. She isolate. Okay. She has endocarditis. She has endocarditis. If I'm in the room, and is she gonna give me endocarditis? Now, because her immune is low, we delay there, make sure she not around with people who sickly. But it's not that she can pass me her endocarditis. Guys, understand that. This is what, I have a student that took NCLEX last night, and she went to Hawaii, and she got 85 questions. So we don't know if she passed yet because she don't want to check. And you know, Hawaii, I can't check for you. If it was Florida, I know before you know. But Hawaii, she has to tell me, so we waiting. And she said, Miss Sonia, Hawaii was so tricky because they kept saying the patient had asthma. Do you isolate them? Guys, she got asthma. How can she give me her asthma? She got COPD. How can she give me her COPD? So that's where they're getting you guys. Just because her immune system is low. Immune system low means if I deal with her, I can make her sicker. Because itukisa low. That's it. Guys, that doesn't mean she can give me her COPD. TB, you can give me your TB. Pneumonia, you can give me your pneumonia. You guys got to be careful, right? You got to be careful with these questions. All right? She said they killed her. And she real good. She said Hawaii was very hard. Anytime the student tell you the test was very hard like that, that means they went and passed. Anytime you got 75 and question, and you say, oh, it wasn't that hard, you fail. Because the 85 question or the 75 question, trust me, you got the hardest of the hardest. And she said, whoa, 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 whoa. She said, Miss Sonia, tell the students, don't even, I'm telling you, Kui, Hawaii, for no reason. You need to run towards Florida, I'm telling you. And if you keep going to Hawaii, you can't pass. Guys, you gotta analyze your situation. I'm not trying to be a Debbie Downer. I'm a real person. If you see you going to people test 10 times, you can't pass. You got to go do something else. Let me tell you what they have out there. They got open a funeral home. Hell, you want to be rich? That's how to do it. Go be a dialysis person. There's other things to do, money. It's not only nursing. If you see you can't pass, do something else. They got this investigation. If this person died, you can work with the funeral people to see why. It's like a CNA job, but they make it $25, $30 an hour. It's not only nursing. I want you to do nursing, but you got to look at it. It may not be for you. I'm telling you, because students out there shooting people, committing suicide, because you can't pass the test. You can't cry. You can't cry every day. You gotta analyze who you are. Maybe nursing ain't for you. Hell, do something else and make money. You stand dying, nurse. There's a lot of things you can do. Come to me and I can help you do a career change. Hell, open a funeral home. You know how much money you can make? I'm in the wrong field. My boyfriend have a funeral home, honey. I'm gonna marry him. I told him no, we get married. You crazy. Each person is $12,000. And if they got insurance, $50,000 guaranteed check. What's wrong with y'all?
But you have to have $100,000.
No, you don't. No, you don't. Soon as you get the license, they give you a loan, baby. You worth $1 million. Ask me how. Okay? Stop thinking the money is nursing. Yes. 2 years. BCC. You can open an adult daycare. See, Glamoon. Ask me how. I will tell you. Stop thinking it's all nursing. I got to work St. Card. No, you can teach nursing. Ask me, I'll tell you. There's other things you can do. Cook. Those of you who's good cook, open a Haitian restaurant. A drive-through Haitian restaurant. Y'all laughing. See? Come find me. I'm not only a teacher. I'm a businesswoman. Come talk to me. A penny will flip it. Okay? Any question with endocarditis? Now, let's go to valve disease. Okay, so, yes. What machine test? You tell me. No, see, no, that's how we do. What machine test?
Thinking that when you do Iecture,
Echo. The doctor can order any test. The doctor can order any test. Echo, cardiac cath, but which test is important? Very important for this. To see the bacteria. Which test will see the bacteria? Remember, WBC is blood test. She asked machine test. Cardiac cath. Listen, is an EKG important here? No. Why?
because there's no tissue.
There's no what? There's no chest pain, no dead tissue. Any question? We could see when you understand, you're able to answer your own question. Okay, endocarditis. Check. Now, in the heart, we have clot problem, right? We have grease problem, so we have CAD. Watch, this is an important piece. We have MI, necrotic tissue, right? We have MI. Watch. So we have, this is a disease. Stay with me. This is a disease, right? We have heart failure. Okay? Now, what is angina? Angina, oh, I hear a phone. I hear a phone over there. Everybody that's going over there. You ain't gonna be no nurse. Yeah. There you go. Look at so deal you. That ain't my phone. Okay, so look. Hey, very important. Look. On the heart, stay with me. Important. CAD is a blockage here. Glass. True? Yes. Am I? Necrotic. Angina can be this or this. True? Heart failure, the heart not working. Endocarditis, there is vegetation around the heart. You with me?
Yeah.
Now, which part of the heart that I didn't mention had a problem? The valve. We can have valve disease. You remember, this go into valve disease and then go to AFib and then go to heart failure. Watch. This go to valve disease, AFib, and go to heart failure. You with me? Valve disease, that means irrigation yo kisa, not working. Guys, what is the job of the valve?
Allow them.
Open,
Yeah.
take clean blood, take dirty blood, right? Push it to the lung, so the valve have a job. Immigration, I call them immigration. Now, let's see what can go wrong with the valve. It can stay open. It can be clotted. For example, you get a perm and you do your own perm at home. And you wash your hair in the tub. What happened to the sink? Clog. With what? Chevette. What will clog? This is calcium. Calcium, blockage. Calcium. Calcium will block this, occluded, and it's called mitral valve stenosis. Stenotic means bouché, clog. Just like the hair fall in the sink, right? The drain. Now, the doctor, right, will have to do several things. First of all, machine test, he'll do a cardiac cath to try to clean it, remove the calcium build up, right? So, and sometimes he'll give you calcium channel blockers, right? Or he'll replace the valve. And that is where your NCLEX question come in. If I don't fix the endocarditis, la bloquée valve là, which is called mitral valve stenosis, which is called go to AFib, which can cause heart failure. If the mitral valve is occluded, that means blood is passing like this, slow. And so the heart goes like this. And what are you at risk for? Clot. And that's why they give you Coumadin for life. Look on the board. Endocarditis causes valve disease. The valve disease, the valve is what? Occluded. So the heart is beating like this. You have this. Stay with me. How is the EKG? How is the EKG for AFib? No P. No P. No P. Where depressed? Boy, I'm going to put you out with the burn. I'm going to go get the light in the back. AFib. AFib no depressed. AFib no P. Oh, come on. Stay with me. Endocarditis, valvular block. The valve disease causes AFib. How's the heart AFib? So what are you at risk for? Clot. So I do an EKG here. What is the EKG going to show? No P. What the doctor going to give you here? Coumadin. Because we don't want this to go into what? Heart failure. You got it? Now, when you have mitral valve stenosis, right? If the medication here don't work for you, we're going to replace the valve. When we replace the valve, we can replace it with two type of valve. One made of metal, fat, and one made of animal. Let's go on the right here, page 687. Oh, turn, pardon, I said 687, pardon, 689. Right? You with me? Should I go on the board and do the Shema again? Let me go on the board one more time. Y'all need to wake up this morning. Y'all sleeping. Take a deep breath. Okay? Look on the board. I put all the different disease on the board. True? Yes. Okay. I said endocarditis, which is a bacterial infection that causes vegetation, inflammation around the heart. You give the patient antibiotic fluid rest. We got that. Right? Now, endocarditis, if you don't fix it, it gives you what? Valve disease. What the little short man want now? Mira, yes. Who parked there?
No one.
No one. Mira. No, tell them.
Ahí no parqueó nadie de aquí.
Sí,
Sí, pero no son de acá.
No.
No, de aquí no son.
Acá.
No, mijo.
Yo creo que tiene razón. Porque hay dos especialistas que le dijeron 3 veces. Le dijeron 3 veces. La secretaria. Delay everything. When she was told 3 times, she even told her don't come in until you move the car. She was delay. Huh? I can't hear. We're talking. Binga. No, he
Oh my God, that's
didn't.
not
No, don't say that.
Don't say that, Victoria.
I know that's bad. See, guys, let me tell you what they're saying. They're saying the patients who go into the doctor office cannot get the kids, the sick kids, because we taking over the parking. The older ladies that are playing bingo, they're old. They're trying to get in the bingo. We're young. We're nurses. Just park in the 1,000 parking. Please, you see, every morning I go through this. You don't supposed to park within this parking. Saturday, no problem. But when it's so busy, I got more customers, and the other people are complaining. Although they say, "Good morning, Miss Sonia," they are talking about me like a dog. Please, don't park there. Please, don't, just for the old people and the sick kids. Okay? All right. No, they're not new. They're my PN student. On Tuesdays, they come to school. It's slow. So they park there, but that's why. It's not their new. They know. All right? So, but thank you. Half of you guys didn't park there. But anyways, that's his job. That's Ernesto. He cool. Okay, so endocarditis give you valve disease. She said, don't say that. My Spanish nurse teach me all the bad words. Right? And I teach all the bad words in Creole. Right? All right, so let's go. Endocarditis give you valve disease. Valve disease, if you don't fix, give you AFib. The Coumadin you give it, guys, is for this, the AFib. Not for the valve disease. Now, I'm going to talk to you about when you give Coumadin for the replacement of the valve. So, endocarditis gives you valve disease. Valve disease, if you don't fix it, gives you AFib. And you already know the treatment for AFib. If we don't fix it, it goes to heart failure, and you know the treatment. Any question? Now, the doctor gave all these medications, and it don't work. So now we cannot leave the patient with the bad valve. So we need to fix the valve. The doctor going to go and replace it. Put a new valve. He either going to put it with a metal, or he's going to put a valve made of animal product. Now, NCLEX bring culture in. Now, I'm Jehovah's Witness. Can I take the one that made of animal? No. So that's how NCLEX asks you the questions. So there's two type of valve right here. Replacement. Okay? The replacement for the valve is either mechanical, which is fat, metal, mechanical, or bioprosthetic. Let's do mechanical. Mechanical valve are the one that made of metal. Y'all, it's D. Tout le monde wear D. Raise your hand if you don't see it so I can help you. D. Right here. D. You see it? Raise your hand. Mechanical valve made of metal. When the doctor replaces it with the fat, with the metal one, for the rest of your life, you will be on Coumadin. If the doctor put the one that made of metal, for the rest of your life, you going to be on Coumadin because you at risk for clots. Okay? If the doctor put the one that made of animal product, for the rest of your life, any procedure you're going to get, you get antibiotics. Any question? Anytime you have valve disease, you have murmurs. We cool? Put NCLEX on that for me. Okay? All right. Now, box 50-10, you're going to put NCLEX. Anytime the patient have a valve disorder and the doctor replace the valve, these are the teaching for the patient. NCLEX tests you on diamonds. NCLEX tests you on boxes. Anytime the author puts something big, anytime the author puts something in bold, that means it's important. Okay? Any question? Now, turn to page 690. Dvt. Deep vein thrombosis. Okay? Let me put it in red. Dvt, you learn it in 3 spots. Pre-op, post-op. You learn it in OB complication. You learn Dvt in cardio. Guys, let me explain something about Dvt because I think the students think Dvt is a heart problem. Dvt is not a heart problem. Dvt is a problem with some type of occlusion that's in the vein because you're not moving. If I don't fix Dvt, it can go to PE, which will affect your respiratory and your heart. That is why DVT is in the heart section. So DVT is called deep vein thrombosis. Now, and it goes like this. So DVT, bull, right? Because you're not moving. NCLEX asks you a lot of questions. How do you know the person have DVT? You say positive Holman sign. No. Positive Holman sign help. It help. It's like an assessment. But the number one assessment to do to see the lady got DVT is to assess the calf. You're going to see one small, one big DVT. When you take her vitals, everything going to be high DVT. So I don't want you to say, positive Holman sign is the true indicator of DVT. It's an assessment that can help. So DVT, what causes it? How to prevent it? If I have it, what is the last result? What is the last result? PE, which can lead you to heart failure. That is why DVT is in the cardio section. I don't want nobody to say DVT is a heart problem, Miss Sonia. I explained to you why it's in the heart problem, why it's in the heart section. Cause lack of fluid, lack of fluid, lack of movement. Ooh. If I'm on birth control, you bought it. If you are menopause and you take the estrogen and the progesterone, you bought it. I didn't say menopausal patients have DVT. I'm saying when menopausal patients take those drugs, give you DVT. Right? Any question? Hey, that is why. You know who's at risk for breast cancer? Menopausal woman. Y'all know that. Why? Because they take the estrogen. Now, how will I prevent this? See, on my test, on the cardiorespiratory neural test, I ask you cause, prevention, and you kind of, I ask you this, you give me this. I ask you this, you give me this. Like, ooh. Cause, qui ça cause me? M'bavle game. Qui ça pou fait pou m'ba game? English. What do I need to do to not get it? That's not the same as cause, right? Like the students don't know the difference between cause and sign and symptoms. Because I didn't drink water, I'm dehydrated. Sign and symptoms is the dehydration. The cause is because I didn't drink water. The students flip those. You got it? Don't mix those. So, prevent. That don't mean I got the bull yet. Be careful. Prevent me mpoko genye. So, upaka di bang heparin mbage bull. English. Prevent me, I don't have it yet. So why would you say give heparin? The only way you'll say give heparin if she got history of bull, of clot. So prevention, you're going to give Lovenox. Prevention, you're going to give Fragment. Prevention, you're going to put Ted Stocking. Prevention, you're going to do SCD. Prevention, you're going to tell the lady to walk. Prevention, you're going to say no birth control. Or if you are on birth control, exercise. Any question? The only way heparin will fall under prevention if I got history of clot. Any question? Yes. Be quiet. Prevention. Lovenox, fragment, TED stockings, SCD, walk, no birth control, or if you are on birth control, you want to stay on your birth control, exercise. Yes.
If you have a history of it, and why you will get Lovenox and
No, I didn't say that. I said if you have a history of it, you will get heparin.
History of clot,
yeah,
right?
but if you, like if after the surgery, if the patient don't have a history of clot,
What about the fragment?
you okay. To prevent
It's like, don't fix what is not broken. You see what I'm saying? Be quiet. For example, if I have two friends and I bring you to my house, we have an apartment. One of the friends stole a purse of mine before. One of the other friends, she's cool, she's nice. So both of them come to my house. The one that I have history with the sticky finger, I'm going to already be prepared for her. Parce que vous n'aimez long. Ah, you see that? The other one, she cool, so I'm not going to even bother her. I can just watch, but I'm not going to be on alert. This one, she got history of clot. She had history of DVT. So I cannot take the chance to just give her fragment because she may have PE. So I'm already going to prepare for her. Yes. No, but be quiet. Bosch and Serena Williams have what you call an autoimmune disease called good posture disease. It is a disease that people who do a lot of athlete at risk for clots. And that clot gave them PE. It's just like lupus, but it's for people that do strenuous stuff. And that's what happened to Bosch. Tamara, no, she just had a DVT from traveling. Mini leaks from traveling, from sitting a long time. So the teaching you tell these people when you travel on a plane like that, wear TED stocking or walk while traveling. These people who travel for long hours. Okay? But Serena Williams, they thought it was lupus. It's not. It's good posture, autoimmune disease. Bosch, autoimmune disease. So Bosch is on Xarelto, so he do commercials for, yeah, because he's taking anticoagulant. And he do a lot of exercise and for what? The cause, lack of fluid, lack of movement, birth control. Okay? And good and menopausal when you take estrogen and progesterone, which is birth control. We got it? Prempro, Vavel, right? Now, I have it. Yes.
Can you clarify what SCD means?
Sequential devices. The thing that you put in the leg when you hospitalize will cause the blood to circulate. If you have it, the bull, now I have it. You cannot go go put 10 stocking. You cannot go walking because I have it. Stay with me. Now I have it. If you have it, the first thing you're going to do is bed rest. IV fluid. You cannot go put sequential device because it's going to cause the bull to move. And you're not going to go elevate no leg or no pillow yet. You're going to bed rest IV fluid. You're going to keep the legs stabilized, but you ain't going to elevate. You're going to give them heparin. After you give heparin, you're going to do x-ray. You're going to move. And then you're going to elevate it above the heart. If I have it, the CNA come wash my feet. A massage. Mula move. Patient to move. This is the number one reason why LPN lose their license. I'm going to tell you. Patient keeps saying, I have pain. And you giving medication and you don't go assess. Guys, anytime you just give patient medication and the patient keeps saying they're in pain, the pain that they're in is worse than regular pain. Stop thinking everybody a drug addict. And let me tell you something. When the drug's not for you, they for the agency. Why your business, like the Jamaicans say, why your business? You go and the person keep telling you, I'm not giving you pain. Who are you? Long as the patient respiration is not down, you assessing. If you just gave a patient pill medication, 15 minutes, and the patient keeps saying it's getting worse, 99.9 is getting worse. Right there, that tell you the patient have DVT. LPNs, the patient keeps saying I got pain. Instead of you assessing, you keep giving pain medication, they go back in the room, patient dead. How about your license is gone? Gone with the wind. Why? Because guys, that's why every drug you give, you must assess. Because they go in the room, patient not for PE, maybe all you did all morning giving pain medication. Yes, you give the pain medication, order it. The doctor order it, you give it, but you got to assess. You give the patient 3 morphine pills back to back. The patient keep yelling, baby, it's worse than pain. You need to call the doctor, say, hey, stay in bed. Put oxygen on them, put them high follower, leave the legs not up, keep it straight, and say, hey, stay right here. Get your CNA to sit with the patient, and you go call doctor ASAP. Because that patient had DVT. And don't go massage it, just touch it. You touch it, it's red than fire. It's hot, it's warm, one of the legs big, one of the legs small, or they have the DVT here, you see a big old lump right away. You better call the doctor. See, LPN have a patient like that and you don't do nothing. Don't you think they should not be a nurse? Yes. I don't care if you have 30 patients. Every drug you give, if nobody telling you sit in the room, hey, how are you? You good? Yes, check it. How you doing? Don't go send CNA to check on your patient. I don't care if you have 35 patients. You give a tagament. I don't care what it is. No, I'm just checking. How you doing, girl? Yeah, all right. And you go to the next room. You all right? All right. And you keep moving. Girl, yeah, I'm just checking. You all right? Yeah. Keep moving. Because you got 30 patients. But you got to play the game smart. Oh, yeah, and you going to go to jail, too. Because that is malpractice. Y'all know what? Yes, nurse prend gros prison. If he don't say I'm going to Haiti, yeah, he prend you right. They gonna get you right in Haiti. All right. Okay, so have it. You You give heparin, X-ray, then you elevate. Now, we don't want it to get here. Or if it get here, the patient will say, oh, I can't breathe. Hey, PE, what's the first thing you do? Oh, I hear a phone. Positioning. Semi-fowler. Semi-fowler. Position, semi-fowler. O2. Right? O2. This is the nurse. The doctor, he got PE. What drug you see the doctor may order? Heparin or what? Thrombolytics. Because this is emergency. Any question? You see how smooth it is? And this is what makes the patient go into heart failure. No, I got baby both. No, you know, or. Nobody, hey. No. No, I said heparin. Oh. Monique, they met fatigue, ma jambe dit ça, baby. Oh, eh bien, il y a probably some baby so they didn't. No, guys, you will never give heparin and thrombolytic. Monique, même student, you're going to say. They food somebody was going to say, hey. Now, who cannot get thrombolytic? Patient who have history of what? What else? One more. Whoa, ischemia. Renal. Anytime you have history of kidney problem, you cannot take it. And a person who your blood pressure can go down, you cannot take thrombolytic. You remember page 707, contraindicated? What? Right there. You see, because we didn't know that, that tell me we not studying Monday, Tuesday, med surg. Munan diri no la sa di musunyoli. Because if you was reading like I send you to do the schedule, right? Any question? Okay, so DVT scratch, valve disease, endocarditis, heart failure. Okay, now we on PAD. PAD term. Okay? And only read what I give you to read. Please. All right. Peripheral arterial disease. Now I'm going to raise the heart because it looked crazy. It's too much. Okay. PAD. Peripheral arterial disease. Right? Ready? We just gonna do the heart. PAD. It's on page peripheral. It says arterial. 692. You got it? It's a chronic disorder in which partial or total arterial occlusion deprives from the lower extremity. Anytime you're reading, you got to read what is the disease. What I'm finding is you guys listen to tape and you're not reading. You must read the book, okay? Now, tissue damage occurs below the level of the arterial occlusion. What caused the peripheral arterial disease? Atherosclerosis. So there's type of occlusion that's in the arterial of the heart that preventing blood from flowing from heart to feet. Now, when you have PAD, let's look at the leg. 99.9 all the problems happen in the leg. So I'm going to draw the leg here, big leg. You know, big green mark, a black mark. Now this is very big on NCLEX. Sometimes NCLEX give you the picture. Right? So this is the toe. This is the leg. Right? So if the patient have an ulcer here, so on our leg, you can have an ulcer here. You can have an ulcer here in the heel, which is diabetic ulcer. Stay with me. When you have an ulcer here, it's a venous ulcer, vein, and you need steroid. This one, since it's a diabetic ulcer, you need insulin. When you have peripheral arterial disease, créole, malingla, c'est sous un pied. English, the ulcer with PAD is on the toes. So the ulcer is in your toes. That is PAD. The leg is skinny. The leg is cold. The big toe, remember all of our toes got little hair on it, right? His toes, there's no hair. The malay, the ulcer is on the toes. The whole leg is shiny, cold, and African American black. Who gets this and what caused this? Not taking the blood pressure medication. Hypertension caused this. Uncontrolled hypertension. Okay? Now, so NCLEX give you the leg. They normally give you the picture. If the ulcer is on the side of the leg, which young people normally get, it's a vein problem, they will give you steroids. So we will isolate this patient because of the steroids. If the ulcer is in the heel of the foot or the plantar of the foot, it is diabetic patient. If the ulcer is on the toes, it is a peripheral arterial disease, and we will give Plavix. The drugs we give is Plavix for PAD. Now, how do you know the patient had PAD beside the leg cold, the leg shiny, blood pressure on arm is high?